Welcome back to Upfront. There's growing concern for hospitals in this pandemic. How well prepared are they for critically ill patients, and what more do they need? We're talking about the situation facing Wisconsin hospitals with Dr. Mark Kaufman. He is Chief Medical Officer for the Wisconsin Hospital Association, and he's joining us now through Skype. I know you are so busy handling this, so thank you for your time. What would you say is your number one concern right now?
I think the number one concern for hospitals around the state is preparing for a potential surge of large numbers of critically ill patients with COVID-19. That has not happened yet, but that is, I think, the number one concern.
Of course, you don't have a crystal ball, but any idea when that could be happening, when we might see that surge?
So nobody really knows when that is happening, but it could be weeks or even a month, or it could really be dampened. The more effective we all are with social distancing, and especially for high-risk patients, we have the opportunity to really lessen the impact of COVID-19. We know there will be a wave of sick COVID-19 patients, but the question really is how quickly that's going to happen and how severe that wave is going to be. If we really take social distancing to heart and embrace it, there is a good opportunity to slow the wave and also to reduce that surge of patients.
And I think some people are sitting at home and saying, is it really that big of a deal if I just maybe get together with a few of my friends, or I go out and conduct life as I normally would? But you're saying that is a big deal.
It is a really big deal. Because of the limited availability of testing, we can't really be sure who has COVID-19 and who does not. There are some people who harbor COVID-19 virus and are infectious and have minimal or no symptoms. That's why social distancing is really so important right now, especially in light of the fact that we do not yet have a vaccine and we don't have any proven antiviral medications. So social distancing is really the key.
And I'm so glad that you're joining us, because you really have a grasp on our hospitals in Wisconsin as a whole, because really almost all the hospitals and the hospital groups are members of your association. So we keep hearing that there could be this shortage of hospital beds. What is the status of that in Wisconsin? Right
now, we have plenty of hospital beds, including intensive care unit beds, and we have enough ventilators. But that's right now. Question really is, if there truly is a surge of critically ill COVID-19 patients, will we have enough resources? And that goes back to the whole conversation of social distancing. If we can slow the wave and reduce the height and lengthen the amount of time over which COVID-19 patients need hospitalization through social distancing, we'll have a much better chance of matching supply of critical hospital resources to the needs of Wisconsin patients and citizens.
And when you look at what's happening in other places across the country and really across the world, do you think in the future we will have enough beds? What could the situation look like down the road for Wisconsin specifically?
It's a great question. So what we don't want to do is end up looking like northern Italy, which is really slow with public health measures such as social distancing. It's a small country, but Singapore did a great job in terms of social distancing and really clamping down on the movement of citizens, at least temporarily. So what it's going to look like in Wisconsin really depends upon the natural history of the virus, as well as how we act as a community and how we act as individuals.
What about those important supplies that our healthcare providers really need to do their jobs? We keep hearing about these shortages. What are you hearing from hospitals here in Wisconsin?
So that is a huge concern. So-called PPE, personal protective equipment, is really a crunch point right now, specifically with respect to paper masks and then so-called N95 respirator masks, which healthcare workers use to protect themselves from becoming infected with the virus when they care for patients. All hospitals are following CDC guidance with respect to appropriate conservation of personal protective equipment. Hospitals and WHA, the Wisconsin Hospital Association, are working with partners such as construction companies in terms of repurposing N95 masks for construction that can also be used for healthcare. People are looking for alternative sources of supply. And we're in contact with states such as California and New York and Washington that have been really the local epicenters of the pandemic. And those workforces have really been used some innovative strategies to address their supply issues.
Well, Dr. Kaufman, we really appreciate your time. We want to thank you. And if you could pass along our thanks to any of the other healthcare professionals you see, really important fight here. Thank you.
Absolutely. And thank you. And it's great to have the news media helping to get out these really important messages. So thank you.
GE Healthcare is trying to help hospitals and clinics during the pandemic. The company says it's increasing its manufacturing capacity and output of equipment like the ventilators that we've been hearing so much about. GE says it will be producing those around the clock. There are questions about how coronavirus could impact the April 7th election in Wisconsin. We'll hear differing opinions from two members of the Wisconsin Elections Commission, one Republican and one Democrat. That's coming up next on Upfront.